This is our ambidextrous Eurus S8 treatment centre. Firstly, we're going to discuss patient entry into the dental chair and seating them comfortably. So I have a colleague from my office who's going to assist me. We'll just move the delivery system. One of the features of that delivery system on the S8 is that it can move back behind the back of the chair out of the patient's eye line. And my patient's going to come into the room. First thing we're going to do is lift the arm and swivel it out, so allowing access for the patient into the chair. But you notice the headrest is in one position, so it's set all the way down. So this creates a situation where the patient sits incorrectly in the chair. So if Patrick, if you wouldn't mind getting in the chair for me. So what you can see here is that Patrick's laid down, put his lower seat section much further down the chair than he needs to be. So when we actually bring the chair back into supine, you'll notice that he slides even further down the chair and is completely in the wrong position for dentistry. So what happens a lot of times is the dentist or the nurse asks the patient actually to shuffle themselves back up the chair. So if you, Pat, wouldn't mind just shuffling yourself back up. Now, even though Patrick's sort of shuffled himself back up there, he'll be comfortable for a certain amount of time, but he will be sooner rather than later shuffling around and moving again. And if that's mid-treatment, then it causes you wasted time with your hands up in the air waiting for the patient to settle. So I'm going to show you how to make that a little bit more comfortable for the patient. So we're just going to bring the chair back up, Patrick. So remember to open your arm and allow the patient out. So if you jump out for me, move the light away. Again, on the side of the headrest here, there's a dark grey button which height adjusts. So you push that button in and then it will move the headrest back up and down. And on the side of the mechanism here, there's a squeeze, a grey squeeze. So what you do is you squeeze that in and it articulates the headrest out to where you need it to be. Now the correct position probably for Patrick and his height is probably about here. So I'm just going to set that headrest there and ask Patrick to sit back in. But a key factor in sitting any patient into the chair is to make sure that they shuffle right back into the bottom of the axis. If you could just shuffle yourself, that's it, perfect. So you're sat right, and then just adjust the headrest down to where it meets the back of his head. Close the armrest in, and we'll bring the chair back down. And what you can see from here is that Patrick's lower lumbar has got good support now, and his shoulders are nicely supported and his hands have come to a naturally relaxed position. His head's in the headrest waiting to go, so he doesn't need any more adjustment than that, and he's in a comfortable position. So I want to show you one other thing to do with the headrest that will help when you're trying to find a comfortable position, particularly when you're working on upper arch, which is one of the most difficult surfaces to look at with direct vision. So if I want to see Patrick's upper arch here with direct vision, the only way I can actually do it is to bend over like this. Now that's a position that all dentists are trying to avoid, is that question mark spine position where you're bending right over. You cannot eliminate tilt from dentistry. There's always going to be an element of tilt, but what you can do is reduce the amount of crouching over. So what I'm going to do is I'm going to adjust the headrest here. So there's a couple of things that you need to know first of all. When you're adjusting any headrest or moving it, you must support the patient's head and the weight underneath the cushion here. So keep hold of it, because once you release the articulation, it's very easy for it to drop, the patient's head to drop down. So what I'm going to do, I'm going to push the bar in, and at the same time, I'm going to press the articulation and tip Patrick's head back. So you can see from here that as the further we go the bar in, Pat's head automatically sort of tips up here, so we've extended the thorax. And now if you could open the upper arch there, Pat. So if I was to try and work on the upper arch, I'm not saying I can see every single thing. Obviously a lot of the work is done with a mirror, but you can actually see much more vertically above the upper arch there. And then for the lower, what I'm going to do, thank you for that, is just pull the bar out and chin forward, and now we can see onto the lower arch with good vision. One of the useful features of this product is that the delivery system can be moved around the back of the chair That can be for two reasons. Firstly, if you have phobic patients who are afraid of dentistry and anything to do with the instrumentation, they're tucked away out of the way, leaves the chair nice and open, clean of any handpieces or other sundry items that you may have in patient view. Also, this position gives you a chance to sit with the patient still discussing treatment, but knowing that your nurse can be doing clean down behind while you're doing that, so it's not wasted time. So this chair also has a height adjuster for the delivery system. There's a silver turn screw here that you turn and loosen off, and then you can raise or lower the delivery system and then retightening it afterwards. All of our Eurus treatment centres come with our intuitive touchscreen, which will be covered under a separate video. In the meantime, I'd just like to show you some other things underneath the delivery system that may be of assistance to you. The first one is when the water bottle needs changing, there's a switch on the side of the unit here. Whoever's changing the water bottle will need to deactivate the pressure by hitting this switch on the side here. You can hear it deactivating, then it's safe for the person who's changing the water to unscrew the bottle, fill it with water, rescrew it, and then repressurize from this switch again. And next to this you have these two, a blue and a yellow turn screw. These are actually the water and air controls. The blue is water and the yellow is air, and these are for the 3-in-1 syringe on the doctor's side. So if the doctor wants increased water pressure, they can turn the valves to increase and decrease. Underneath on the left-hand side of the delivery unit, you'll see these blue valves. They're numbered 1, 2, 3 and 4. And it corresponds with 1, 2, 3, 4. And that can increase or decrease the water flow to the handpieces. Further back close to the back of the unit is the oil collector pot. From this oil collector pot you unscrew, and this is a way of making sure there's no oil residue collecting from the exhausting of the handpieces. If you find lots of oil within this pot, then there's either over-oiling happening, or possibly if there's an O-ring failure on a handpiece coupling, sometimes the oil can get mixed with water. If there's a lot of water in that pot, then it's probably best to check your couplings and the O-rings on those. And then you just take it back and screw it back underneath. Make sure it's on tight. We're now going to discuss the 900 series light, which has a sensor adjustment, but also can be controlled through the touchscreen as well, and from the nurse's instrumentation side. There are some nice features on this light that make it beneficial for the user. Number one is that you can actually, it has a third axis of rotation, so you can move the light around the arch without actually getting in the patient's eyes. A third axis of rotation is really useful. It's probably best always to keep your Belmont light at 1 arm's length away. That creates a sort of a nice focal pattern that fills the cushion but doesn't leave any shadowing on there. Also, with LED lights, a lot of companies actually set the intensities for you, but we at Belmont decide that you're the best person to know the right intensity of your light. You have an adjustable intensity switch on the back here, which can increase and decrease the light from 39,000 lux down to 4,500 lux. You also have on the light, the sensor obviously switches on and off, but the sensor also means if you wanted to put cure safe mode, and basically so your composite didn't set, you can actually put your hand behind the sensor, not touching the sensor, but behind it, and it steps down into a lower intensity, 4,500 lux, so it doesn't actually cure composite. It takes blue light out of the spectrum. And then back activated, we turn it back on. You may notice we also have a mirror in the center here. The mirror is very useful for, let's say you wanted a patient to have a look at some of the work that you've just done. They can actually hold the mirror to their face and actually see the work that's been done. Or if the patient wants to watch during dentistry, some patients are interested in dentistry, so they don't mind watching. Others will hate that, so you can rotate the mirror and swivel it round so it's blank on one side so the patient doesn't see any of that. You also have these autoclavable handles on here that can be detached for clean down on both sides. And also there's a nice feature with this light that sometimes the nurse feels that they can't actually get vision in where they're actually trying to apply the suction tip. So they end up leaning completely into the dentist's eye line to see what's going on. So if you were to address, let me just show you something here. So if I was to put my hands here, this is like a nurse's head in the way of the light. This can actually still get light around that blockage. Okay, we're now going to deal with the S8 nurse's workstation. There's a few features on there that I want to show you. Firstly, there's a safety feature. So the actual extending arm here, if this arm was lowered onto a worktop or onto a stool, it can cause damage. So what we have is a safety switch. So if you watch the spittoon and the top of the spittoon here, we have a light, a blue light. If this lifts and actually comes down on something, it will turn that red light on and that will immediately stop the chair from moving. The next thing I want to show you is the fact that the suction manifold can be scissored close to the spittoon here, or if you're working down here and you want to move the suction instrumentation closer to the headrest, you can bring it all the way out here. Sometimes a dentist finds themselves working single-handed while the nurse has left the room, and this gives them a good position to get in. But that can scissor up and away out of the way there. You'll notice from here we have suction, and this suction has got the 45-degree angle on there. This just basically takes the stress off the hose so the nurse can go straight to the oral cavity without actually having to bend the hose over. It can be straightened like this, and the point that I'm mentioning is when you see sometimes a nurse evacuating from the mouth, they bend this hose completely over, and it puts quite a lot of strain on the hose here, and occasionally you can get cracks and splits from tears from there. So if you can, swivel it to 45 degrees. Also, while I've got that out of the holder, underneath these holders there's a little clip, and it means that you can lift this clip and lift the holder out for cleaning. So that clip is under there, you can see it there, and then the nurse can take that away and clean that down. And then it just simply clicks back into place and the hose sits back in. And also you have that on the saliva ejector as well on this side. Next, I'd like to show you the sort of drop-down door where the filters are. So these are the filters for the suction. So here we have the filter, and on the top you have this locator. This locator shows you that you have the filter section the right way up, and there's a notch out of the top of the hole here where you took the filter from, and that sits straight into there. It's not a twist and turn, it's just simple push in and hand away. You don't have to twist it tight, you just put it straight in and pull it straight out like that. The hoses themselves are also on quick disconnects here, so they can be detached if you are replacing the hoses or the hoses are starting to look tired. They can be pulled away, a replacement hose ordered, and then pushed straight back on yourselves. You don't have to call a dental engineer to do that. There's a couple of things on the spittoon here that I'd like to show you that actually will help you and help your patients. The first thing is a rotation of the bowl. So the bowl rotates inbound on the patient. In the past, when patients have struggled to reach the spittoon, they've ended up sort of folding forward. This actually goes closer to the patient and obviously means that they will miss the target less. So swivel that back in. Another nice little feature on the spittoon as well is when you take out the central filter here, sometimes at the bottom of the bowl you'll see a staining from there. So what I'm going to do is I'm going to take the bowl off its pivot point here. This can be taken off for cleaning, so you can actually take that away, and you'll see there it's easy to get into all orifices on there. And then you'll notice on here that this is now left with a residue at the bottom, or there's like a drain at the bottom. So if you move this to the right hand side here, you can actually unscrew the base of there, so you can take that away for cleaning underneath. And then what we're going to do is put the bowl back on, make sure it's seated nice and firmly in, and then screw our cap on underneath like that, and then move it back to there. It's always very important to make sure this is nicely seated down and firmly seated, because one of the things that happens is older patients particularly tend to hold onto the bowl while they're using it. They feel more safe by holding the bowl while they're using it for rinsing. And children also do the same thing. So make sure that bowl is nice and tight in there, and that will benefit everyone. Also, the spittoon itself, it can be moved, obviously in its left-right movement, but it can also be moved in a 90-degree away from the chair. So if you needed access to the chair, there is a clip at the front of the spittoon that needs to be released, and that needs to be pulled out to the red band so that we can get the lock taken off the spittoon. It can rotate fully out 90 degrees here. And that gives you greater access as an operator to get close to patient from both sides, maybe for surgicals, something like that. But better than that, even with that spittoon turned out, you can still get the spittoon bowl quite close to the patient so that you've got access, but the patient can still rinse from there. And that's kind of a unique feature. And easy to maneuver and easy to put back into place as well. Following on from the Eurus S8 holder type, here we have the Eurus S8 rod swing, where the delivery is mounted to the front of the chair, as opposed to the holder type, which is mounted to the back of the chair. The delivery system is the over-patient style. It is an ambidextrous system, so the unit can move around the chair both directions, and the spittoon can also cross over. This can aid handpiece collection for the dentist and put it into a position that can be more ergonomic and less strain on the wrist and in the shoulder. So I'm just going to show you how we intend to do that. The first thing, a lot of dentists I speak to, the system is generally supposed to be used in this over-patient position here. Now, a lot of dentists I talk to say initially, wow, that's going to be too intimidating for my patients. They're going to be too scared by that. And I think one of the things that some dentists fail to realize is they do that with the headrest flat like this. If you slightly articulate the headrest back, you change the patient's plane of vision from looking at the handpieces to looking up at you or the light that may be above. So that's one thing to take into consideration. The other thing with over-patient delivery is you're trying to work on the tooth surface with the straightest possible line you can take the handpiece. And because Belmont, we have this compact delivery head here, with rotation on the head as well, so it means that you can move it to any angle you need to. And it's not too big to get in the patient's eye line, but you can actually maneuver it nice and easily, even with the lightest of operations. On the side of the handle here, there is an air brake, and I ask you, if you can, to make sure you use the air brake when you raise and lower the delivery system, okay? It just makes life a lot easier for you. It's designed that way. So if you can, use the air brake button to raise and lower it. Now, talking about the over-patient position again, let's say I was coming into the tooth surface here on, let's say, lower right 5 or 6 here. So what you're trying to do is get the delivery head in a straighter line that you can to come straight into the oral cavity that you're working on and working on the tooth surface. So nice and straight line like that. Again, if you were working upper left 5 or 6, you would come straight in this way, like there. And there's relatively no strain on your wrist by doing that. You've not actually got very much weight on the instrument. This is an electric motor with a slow speed handpiece on there, and that actually is probably the heaviest toolage that you're actually going to get in the dental surgery. So that there is a very light motion. As you can see from the rod itself, there's no pullback. The thing as a dentist you're trying to avoid, some of the earlier systems in the market had springs here at this point. And of course, as you know from science, every force has an equal and opposite reaction the other way. So if you pull that way, when there was a spring there, it used to pull back against your hand and strain it. Now, if this position you find that too much, remember the tray itself, because it's ambidextrous, can move around to both sides as well. So the tray is actually movable. And also, the dentists that I speak to that do buy this system that really find that over patient too much tend to move the delivery system to the side here. So it becomes almost like an ergonomic cart, really. I wouldn't say it's how it's designed to be used, but it does work quite efficiently that way as well. One difference to this design is that the water bottle is mounted to the rod swing post. There is a switch there that you need to deactivate when you're changing the water bottle, and when you refill the water, then reactivate the switch. And that's the difference between holder type and rod type. And really, at the end of the day, it comes down to your own personal preference, what you prefer. As an ambidextrous treatment center, we're now going to move this from right-handed position to left-handed position. Firstly, what we want to do is remove any obstacles that could be in the way of this happening. So the foot control and the stool must be moved out of that area. So keep them right away from the chair. And now we come back to the chair for positioning. Now, the first thing that I tend to do when I move left to right hand is I make sure the chair is set about 5 inches or 10 to 12 centimetres up. So I raise the chair just about 10 to 12 centimetres. I've saved this position earlier, and if you are going to be doing left-right constantly, it's not a bad idea to save this position because it's one of those that you'll use if you're doing it on a regular basis. So the first thing we're going to do this time is we're going to move the delivery system. So we're going to actually come round, moving the nurse's manifold around that side. We're going to bring the delivery system all the way around so that it passes here. Okay, so it's past the spittoon. The idea is that the spittoon is going to go back on itself there. So we're going to scissor this back to here. What I want to show you also is around the front of the spittoon here, there's this clip here, and this must be set to the red band as it is at the moment. So it pulls out and turns to the right, and then it's set to the right there. So that's now freeing up the system to move left and right-handed. On the back of the chair, we have what they call a beauty cover. So it's a plastic cover that comes off. It just pulls off by hand. You then put that out of the way. And if we see on the back here, we actually have a lock mechanism here, this clip here. As you can see from lifting that, it actually maneuvers the spittoon. So now what we're going to do is we're going to move the spittoon and we're going to come back on ourselves. So if you imagine this as an arrow pointing there towards the top of the feet of the chair, you want to keep that always in that position. So come round here, like here. And then you're going to be in a position now where this is inbound and you want to get the suction so that it's outbound. So basically you will move the arm around here, like that, scissor up on the outside, and then put your hoses back in the correct orientation. You move it close to the chair there, you move the delivery system back round, and the only thing we're left to do apart from the cover is actually move the dental light into the right position. The chair-mounted light, the ambidextrous light, should be over on the spittoon side. So we're going to lift the toe board of the chair here, and we're just going to lift this clip here. Then we're going to rotate and move the arm around till the light clicks into place. You hear it click into place. Then we fold it round so that the light is the right way around here. You take the cover, put it over the back of the arm here, and you need to be about 1 finger's width away, a little finger's width away from this rubber joint here. So then we're just going to place the finger in just to measure the distance and then tap on like there, and we're all done.